I'm Meryl Sediasa from Southwestern University FINMA, a second-year nursing student, Section 810, and today I'm going to do perineal care. So first, what is perineal care? Perineal care is usually done to women to help look for lesions and infections in the genital area while cleaning it. And pericare can also help minimize the odor, the urinary tract diseases, and prevent bladder and kidney problems. So in this procedure, we must assume that this is the irrigating solution, a clean pair of gloves, the forceps, cotton balls, the waterproof pad, and the bed pad. So before proceeding with the procedure, you must first ask the consent of the patient. So Mrs. Lin, is it okay if I perform perineal care? It will help us observe lesions or infections while cleaning your genital area. And if the patient agrees, you proceed with perineal care. Given that you have already performed proper hand washing, you must proceed to putting on a clean pair of gloves before starting to do pericare. So before doing the perineal care on Mrs. Lin, we must first put the waterproof pan and the bed pad. So Mrs. Lin, I will be putting a waterproof pad beneath you and the bed pad. So do you want me to help you to turn you to the sides, or can you do it by yourself? Okay. So first we put the bed pad. To your other side. And then we put the waterproof pad. To avoid the draping of the water while cleaning the perineal area. And thank you. So Mrs. Lin, I will be covering you up, and then in a minute, I will be opening up the sheets and taking off your panties. So I will cover the rest of your body, but will be open to your genital area so you can start the perineal care. We must put the patient into a lithotomy position and inform her. So Mrs. Lin, I will be uncovering you and taking off your panties so we can start with the procedure. And if you could bend your knees for me, we can start with the perineal care.
Oh.
So we will start with using the forceps and picking up a cotton ball and wetting it with irrigating solution to start with the perineal care. So Mrs. Lin, is it okay if I start now? So we use it to clean the outer lips or the labia majora from the clitoris to the labia majora, forming a number 7 on the next side and then dispose. Then getting a brand new cotton ball. Wetting it with irrigating solution. And now doing the other side from the clitoris to the lips. Now, when cleaning, you must observe for infections or lesions in the genital area. Now, after the outer lips, must proceed into the inner lips and clean the other side. And then dispose. And then do the same procedure on the other side. From the clitoris to the inner lips. And then dispose. So after that we observe that there are no lesions and infections, we now dry it with another cotton ball. From the inner lips, there is no specific strokes or how many cotton balls should be used in drying the area. From the inner to the outer, as long as the whole genital area is dry. And after that, we will be cleaning it up and covering up our patient. So after all the procedure that we have inspected, no lesions and no infections, we will be now covering her genital area with a sterile pad. So Mrs. Lin, thank you for your cooperation, and shortly after, I will be putting your pants back on.
Go.
So Mrs. Lin, we are finished with our procedure. Thank you for cooperating. And please do tell me if you felt uncomfortable during the procedure, and if there's anything you need, feel free to tell me. So I need to get the waterproof cloth and your bedpan, so please turn to the side. Thank you. And the other side. Thank you. So then again, Mrs. Lin, please tell me if you need anything else. So after the procedure, all things are considered contaminated, so we must dispose of it, including the gloves.